I would like to begin by acknowledging what an honor it is to be gathered here on this traditional meeting ground for many Indigenous peoples, including the Haudenosaunee Nation. I'm going to give you an overview of various sources, as the title suggests, an overview of various sources of data on Aboriginal peoples available at StatsCan, with a particular focus on the census and the Aboriginal Peoples Survey. Those are our flagship data collections for Aboriginal peoples. I'll talk about some other sources. I will also, throughout, pepper my presentation with some examples. By the way, I have not practiced. That's the fourth thing to apologize for. I have not practiced my talk, so I'm just going to speak until Jean tells me to stop. And the other thing is, if you're bored, it's 45 slides. If you're bored, and I have about 43 minutes or so. If you're bored with my talk, you can calculate how many seconds I have for each slide. I'll talk a little bit about some upcoming data collection, enquête à venir, and I would be happy to discuss how you can access our data sets, for example, here in the RDCs. Many of you know that already, but there are many other ways of accessing our data. Statistics Canada is mandated to provide statistical information and analysis about Canada's economic and social structure, and to promote sound statistical standards and practices. There's a bronze plaque in the main building there, and it says, "Serving Canada with high-quality statistical information that matters." That's our new mantra, if you will. Aboriginal, in particular, I'm a member of the Social and Aboriginal Statistics Division at StatsCan, and in particular, we have the Aboriginal Statistics Program, which is the agency's lead for social statistics on the Aboriginal population, First Nation, Métis, and Inuit. There are many sources, as I alluded to in a previous slide. There are many sources of data available for on Aboriginal people. The key resource available at Statistics Canada is the census, what used to be called the National Household Survey in 2011. It's now called the census, short form and long form again. The Aboriginal Peoples Survey, the Aboriginal Children's Survey, somewhat dated but still very useful. And there are other survey data sets that I will talk about. The Canadian Community Health Survey, the Labour Force Survey, the General Social Survey. As well, there are administrative data sources. The latter data sources have less sample size in terms of the Aboriginal population, but they are useful nevertheless. The census is the only source in Canada of on-reserve and off-reserve information on Aboriginal peoples. It is comprehensive. It covers the whole country, all peoples. It gathers at a fine level of geographic detail, so you can do analyses for very, very small areas. We publish data on our website at the community level. It is the only source that can do that in a comprehensive way. The downside is, of course, it only happens every 5 years. That's one of the downsides, and because it's a census, because it's a large program, there is limited information available. While the long form, the so-called long form questionnaire, has a lot of questions, it doesn't delve into a huge amount of detail because it would be impractical to do that. That's why our survey sources are valuable as well. So it covers a lot of ground. So data includes things like basic demographics, families and household, language, education, mobility and migration, income, ethnic, cultural ancestry, place of work, housing, and shelter. On the census, there are two sets of relevant questions for Aboriginal analysis. We ask whether or not the respondent is an Aboriginal person, First Nation, Métis, or Inuit. We also ask about Aboriginal ancestry, so you can analyze both using those key variables. Here's an example of a analytic product that we produced recently in 2016, and it was about living arrangements of Aboriginal children aged 14 and under, published in 2016. This graph shows the proportion of Aboriginal children that are adopted, and the origin or the ethnicity, if you will, Aboriginal or non-Aboriginal status of the adopted parents. You see, typically, about half of Aboriginal children, foster children, live with foster parents who are non-Aboriginal. I have a little note to myself here that says read. So I'll read you an important paragraph. And this is an important point, actually, that I want to stress. It has been suggested that Aboriginal foster children living with a family that shares similar cultural beliefs and practices can help their foster children better adjust to living with a new family. In carrying out this analysis, we spoke with several national Aboriginal organizations. They highlighted the importance of including this information in the published report. So the key aspect here is that we interact through our through various programs. For example, our Aboriginal Liaison Advisor program, of which one is sitting here in the front row. We interact with First Nations with Aboriginal communities. Incidentally, I have to pause here for a second. We use the term, at Statistics Canada, we use the term Aboriginal, even though other departments, for example, Chris belongs to the Indigenous and Northern Affairs Canada department. Certain departments are moving toward the term Indigenous. It's a complex situation. Some Aboriginal people do not consider themselves Indigenous. They consider themselves Algonquin. And so the term Aboriginal Indigenous is still in flux. We're still exploring that and with Aboriginal communities. I will use the term Aboriginal here because that's the way the question is asked on the census. And as you know, the census is designed well in advance. So for example, the 2016 census asked Aboriginal. 2021, we're still thinking about how to ask that question. So I will use the term Aboriginal. The Aboriginal Peoples Survey is the largest and most comprehensive survey of Aboriginal population in Canada. It includes First Nations people living on reserve, Métis and Inuit. It does not include First Nations people living off reserve. And I have to, at this point, make a little bit of a nod to INAC because they sponsor with another organization, the First Nations Information Governance Council, thank you, Center, runs a number of surveys on reserve. For example, the RHS, Regional Health Survey, the FNRES, there's 3 E's, First Nations Regional Employment, Education, and something survey. What's the third? Thank you, Early Childhood. You know all this more than I do. And now they're also organizing FN-led. So they do on-reserve surveys, which cover many of the same topics as the Aboriginal Peoples Survey. So there are 4 cycles currently available in the RDCs of the Aboriginal Peoples Survey. It started in 1991. It's essentially what's called a post-censal survey. That is to say, it uses the census as its frame. So people who respond to that's the next slide. That's another slide. But people who respond and say they are of Aboriginal origin, ancestry, or identify as Aboriginal make part of the sample of the APS. In the cycles 1991, 2001, and 2006, there was an omnibus approach. And it included things on data on education, employment, health, housing, language, and mobility. In 2012, we decided to start a thematic approach. And the 2012 theme was, had a specific focus on education and employment with a health supplement. Specifically, it was looking at school completion. So the Aboriginal People Survey in 2012 was a survey of First Nations people living off reserve, Métis and Inuit, aged 6 years and over. It's a sample of more than 50,000, and this allows us to produce estimates by region, by Aboriginal group, and by level of education. It's important to note that there are other surveys. I will mention that in a slide later on. There are other surveys at Stats Can that have an Aboriginal identifier on them, but as I alluded to, the sample is quite small, and as a consequence, you can often only do pan-Aboriginal estimates, that is, for the whole Aboriginal population. In this case, though, we can break it down by group and by region. Region, in this case, means the Atlantic provinces would be grouped. We sometimes group the prairies as well. We also, however, can produce some estimates for the 4 Inuit regions in Inuit Nunungat. Inuit Nunungat is the Inuit homeland. Again, I say that we can do it by First Nations living on, both status and non-status Indians, Métis and Inuit. We also can produce estimates by level of education, as the survey was about educational attainment. So education group grades 1 to 6, 7 to 12, those with high school completion, those without high school completion, and not currently attending high school. It excludes reserves. As I said, the APS excludes reserves and some a handful of communities living in the people living in the north, in the Yukon and Northwest Territories. The APS is a cross-sectional survey, sample survey. It is selected from, the sample is selected from those who reported to the 2011 National Household Survey, the people who reported identifying as First Nations, Métis, or Inuit, or reported as being a status Indian, or reported being a member of a First Nation or Indian band, or reported Aboriginal ancestry. So we select those people, we select a subsample of those people from the NHS, selected, sorry. The very cool thing about the APS, one cool thing, there are many cool things, but the one cool thing about the APS is that it is a post-census survey. As a consequence, we have all of the census variables as well. More than 100 census variables from the NHS are on there. So it's a particularly rich data set source. Not only does it include census information, but it includes more detailed information not specifically on the census. The questionnaire, there's a special content for children 6 to 14 years old. The questionnaire, they got the same, the children 6 to 14 years old got the same questionnaire as the adults, but with different flows. So they weren't asked certain questions that didn't make sense for a child. So we have a number of things on here about children. For example, early childhood development, number of schools attended, school climate, Aboriginal language instruction, extracurricular activities, peer influences, grades, additional help and tutoring, parental involvement, and school absences, specifically for Aboriginal children. We have some stuff on health, parent-related health, height and weight, chronic conditions, injuries, health care, dental care, food security. We ask about Aboriginal languages, mobility, and housing. Here's an example of something that came out of the for children. School mobility and educational outcomes of off-reserve First Nation students in 2015. If you see the basic message from this graph is that if you changed schools, and if you didn't change schools, your outcomes were, sorry, let me rephrase that. If you changed schools, your outcomes were less good, if you will, than if you didn't change schools. That's the basic message of this slide. I have another note to myself that says read. The idea for this research emerged after speaking to several Aboriginal organizations. In particular, the Assembly of First Nations and the Congress of Aboriginal Peoples had indicated that this topic was of particular relevance. I want to say that the reason I told myself to read that to you is we do analysis at StatsCan in my section, the Aboriginal analysis section. When we do analysis, we don't pick our projects out of a hat. We pick them from the literature, like you do, like academics do, and students. You're given them by your prof, I guess. We pick our projects very carefully, trying to find a balance between the three Aboriginal groups, trying to find a balance between age group, trying to find a balance between topic, health, education, housing, that sort of thing, and interacting very closely with our Aboriginal partners. We have, apart from the Aboriginal Liaison Advisor Program, we also have a number of partners, 6 at the moment, in national Aboriginal organizations. So this is things like the Assembly of First Nations, NWAC, Native Women's, thank you, Association of Canada, others. ITK, Inuit Tapirit, oh my God, Inuit Tapirit Kanatami, thank you. I apologize to any Inuit in the audience. In short, we have contacts at each one of these organizations, and we talk to them very directly and plan our research according to that, to their needs and to their suggestions. We also provide peer review, or we provide copies for peer review by those by our members, our contacts in those organizations, so that there's a back and forth there all the time. As I said, the particular focus of the Aboriginal Peoples Survey in 2012 was on factors associated with high school completion. So things like the number of schools attended, attendance is in a First Nations community, Aboriginal language instruction, repeating a grade average, additional help and tutoring, school climate, support of First Nations, Métis, Inuit culture, personal support, family involvement, frequency of reading, extracurricular activities, peer influences, and dropping out. And with that, you can do all kinds of other things, like the connection, for example, between education and employment experiences. Here is an example: the education and employment experiences of First Nations people living off reserve, Inuit Métis, 2013. We looked at high school completion and the other way around. High school completion is the outcome, and we looked at various participation in various activities. In essence, the more you participate in activities, or given that you participate in an activity such as sports or art or groups or clubs, the higher the chances of you completing high school. There was also a health supplement covering such topics as self-related health status, pregnancy and childbirth, height and weight, access to health professionals, family doctor, nurse, dentist, unmet health needs, mental health, distress scale, suicide, health behaviors, smoking and alcohol use, injuries, chronic condition, community support. The mental health distress scale I want to talk about a little bit more in this slide here. One of our team wrote an interesting paper in 2015, the social determinants of higher mental distress among Inuit in 2015. There is the Kessler scale on the Aboriginal Peoples Survey, which is a validated scale, validated, with in the usual way with a factor analysis in quite some detail and trustworthy in the sense that it's been validated. But on the other hand, we are able to translate this into an Aboriginal appropriate model, in the sense that we have some variables that measure Aboriginal appropriate cultural aspects. So the paper written by Thomas Anderson, in that paper, he not only did he have the Kessler scale, but he has other things. Other things in there, and in particular he used a ITK model for. He based his own modeling over on an ITK, somewhat holistic model, more holistic model, if you will, of health, social determinants of Inuit health. In particular, one of the things we have is livelihood, and we have hunting, fishing, and trapping as questions on the APS. And not surprisingly, these are important aspects of Inuit culture and have a direct relationship to health, to mental health. So we are able to measure, as to a certain extent, the effect of culture, if you will, on various outcomes. This is a huge slide of a lot of things, of describing the various choices of kinds of things that you could do an analysis. The important thing is that the APS is a complement, an addition, if you will, to the census. From the census, you have, as I said earlier, you have more than 100 variables, census variables. You could use the census to analyze Aboriginal people at these 5-year intervals, and you have a lot of information there. For example, you have something on the Aboriginal on the census. Sorry, you have labor force status on the day of on census day. But using the APS, you have a lot of other interesting things. So you can ask things like how people are going about looking for work. What are the barriers to employment for those who are unemployed? And we ask questions like, would they be willing to move, for example? So with the APS, you can go into much more detail than on the census. Again, more information on demographics, income, mobility, Aboriginal languages, and not just the Aboriginal language you speak, but we can rate the ability of whether you speak it well enough at the various levels of detail, and the importance of an Aboriginal language. That's a very valuable thing, cultural thing. The next survey, the next cycle of the survey is 2017. It's in the field now. It started in January, and I'll speak a little more about it near the end of my presentation. But it's in the field now, and again, it's also a post-censal survey. We also have data that's available in the RDCs from the Aboriginal Children's Survey. Now, it was collected in 2006, making it somewhat dated, but it's still valuable information. Much of the information on the 2006 Aboriginal Children's Survey, even though it's 11 years old, is thought of as fairly current. Many things that we find on there have not changed that much over time. We have other sources of information, but it's dated. It would be nice to update it, but it's still somewhat valuable. Data includes child behavior, sleep, nutrition, development, nurturing, childcare, language, activities, parents, guardian, and neighborhood or community information. The Aboriginal Children's Survey covers, generally speaking, 0 to 5-year-olds. There are a few 6-year-olds because they were 5 when they answered the NHS, if you will. Somebody answered the NHS for them, typically. Not the NHS, sorry, the census. It would have been before that. So there are a handful of 6-year-olds, but basically the population is 0 to 5-year-olds. Some examples of research articles written by StatsCan analysts using the ACS data. Child care for First Nations children living off reserve, Métis children, and Inuit children. Dietary habits of Aboriginal children. Health of First Nations children living off reserve and Métis children younger than age 6. Measures of language outcomes using the Aboriginal Children's Survey. Selected findings of the Aboriginal Children's Survey, 2006, Family and Community. The physical and mental health of Inuit children and of teenage mothers. This is from a paper written by one of my new recruits. And she looked at the association between breastfeeding and select chronic conditions among off-reserve First Nations, Métis, and Inuit children in Canada. And she noticed, for example, this one is about asthma, suffering asthma or chronic bronchitis by Aboriginal identity, and what's the third variable? I can't see. Thank you. Breastfeeding, whether they were breastfed or not. Yes. And so the breastfeeding, bottle feeding exclusively, and a mixture of the two. And essentially, there is some indication that breastfeeding is a good thing in terms of outcomes of asthma. Now, we have to be very careful. We also, not only do we publish quantitative research, of course, at Statistics Canada. We necessarily do that. But we want to do it in a respectful way as well. And when this was going through the peer review process, there was some concern that we were chastising mothers who didn't breastfeed. And we're not doing that. It's matter-of-fact stuff. So we don't make value judgments at Statistics Canada. We just do matter-of-fact quantitative analyses. Other sources of data for the Aboriginal population at Statistics Canada. We have the Canadian Community Health Survey, the Labour Force Survey, General Social Survey, administrative data sources such as the Uniform Crime Reporting and Homicide Survey, projections of the Aboriginal population households. The last two bullets there, the Uniform Crime Reporting and Homicide Surveys, even though it has survey in the title, it's actually gathering of administrative data from police services. Projections of the Aboriginal populations and households, there's a thing at StatsCan called DemoSim, which is a huge micro-simulation model from which the Demography Division projects future populations. The Labour Force Survey is conducted monthly. It's a person is in the panel for 6 months, asks questions on it. And basically, it's our second flagship survey, if you will, if the census is the first flagship. And it gathers information on a number of topics. The unemployment rate, the monthly unemployment rate, is the thing that's the key indicator that's published from the labor force survey, but it is a very valuable survey with other information in it. About 4,800 people identify as Aboriginal each month, and well, half are First Nations and half are Métis, and then there's a very small Inuit sample. It's important to note that the LFS, the Labor Force Survey, is also not on reserve. It covers the off-reserve First Nations population. The sample, the quotes annual sample, if you glue together the samples of the LFS, is big enough to get reasonable quality estimates for by First Nations and Métis and Inuit at the First Nations and Métis at the Canada and provincial levels. For other things, you would need a pan-Aboriginal examples. So some examples of major topics: labor market activities, employment and unemployment, hours of work and work arrangements, industries, occupations, wages and salaries and other earnings, and education. Here's 3 slides. Historical slides gathering information about the employment rate. The next will be the unemployment rate, and then the participation rate. 3 quick slides. You'll notice that the interesting thing I see in this picture is the lag. So the dark blue is the Aboriginal population, and the light blue is the non-Aboriginal population. And you see there was a downturn in 2008 to 2009, and you see that there's a downturn for Aboriginal people as well, and it lasts longer. It goes deeper and lasts longer. The first thing you notice is that the employment rate, the light blue, is higher than the dark blue. That's the first thing you notice. But you also notice that the dip is deeper among the dark blue and longer than in the light blue. And you see that dip that happens also, the inverse of that dip, if you will, for the unemployment rate, and basically the reverse story. More unemployment in Aboriginal people, the downturn in the economy lasted longer, had a longer impact, and was a higher impact. And here's an interesting thing. I'm not sure how to describe this. This is the participation rate, the number of people who are employed or looking for work over the total number, and it just dropped in 2010 for Aboriginal people while remaining steady for non-Aboriginal people. The Homicide Survey collects police-reported data on the characteristics of all homicide incidents, victims, and accused persons in Canada. Statistics Canada, with the cooperation of police services across the country, is now able to report Aboriginal identity of both victims and accused of homicide. We now have this identifier on the administrative data collection. It allows us to obtain a clear understanding of who is at most risk of being a homicide victim. Here's an example of some outcomes. A quarter of homicide victims were Aboriginal in 2015. It's important to note that the Aboriginal population is 4%. So homicide victims are way overrepresented, or the Aboriginal population is way overrepresented among homicide victims. The homicide rate is about 7 times higher than that of the non-Aboriginal, than that for non-Aboriginal people. Aboriginal males are greatest at risk of being a homicide victim, 12.85 per 100,000 population. On the other side, 1/3 of people accused of homicide were Aboriginal. Again, so they're overrepresented as victims, and they're overrepresented on the accusation side as well. It's interesting to note that in 2015, the last bullet there, 29% of males accused of homicide and 61% of females accused of homicide were Aboriginal, so much higher rate on the female side. The General Social Survey is an annual survey about 20 to 25,000 households. It changes, the cycles change: time use, victimization, family, roughly every 5 years. The content is repeated. It is the sole source of data, or a leading source, on many topics, social science topics of interest to Canadians. The GSS targets the population 15 and older, living in the 10 provinces, and not in institutions. From time to time, the victimization includes the territories. So there are sometimes northern supplements. In next bullet, there are actually other supplements. And sometimes particular departments will pay for a supplement in either the territories or among seniors. That's happened as well. There have been some record linkage activities with immigrants, for example, where we have extra information. Some current innovations. The electronic, before I say that, the old cycles of the GSS, so in terms of the Aboriginal population, the Aboriginal sample would be around 4%. The interesting thing about the GSS is that the General Social Survey is that in the old days, 5-7 years ago, it was an RDD sample, random digit dialing. So the people were selected by random digit dialing, which meant that Aboriginal people would have been selected, even on-reserve Aboriginal people would have been selected into the sample potentially. There are some issues with the telephone coverage, of course, of on-reserve Aboriginal people, but they would have been selected into the sample potentially. The main problem, if you will, from an analyst's point of view with the General Social Survey is the sample size of Aboriginal people. There is a question asking about Aboriginal identity, and so you do have that information on there, and including First Nations, Métis, and Inuit group, but the sample is often quite small for analysis. Some innovations: we're moving to electronic questionnaires for all cycles 2018 and after. The General Social Survey has had a challenge, shall we say? Thank you. Oh, lots of time. The General Social Survey has had a long-standing challenge with response rates. It's a long survey. It's a long questionnaire. I forgot to mention the APS is also a long questionnaire. If you go back in your mind to slide whatever it is, 10. There were a lot of topics covered on the APS, and that means the questionnaire is rather long. We ask a lot of questions of our respondents, and we place, unfortunately at StatsCan, we place a lot of burden on our respondents at StatsCan when we ask them questions. We are doing a lot of things to try and improve that. One of the big buzzwords at StatsCan is administrative data, record linkage to administrative data. For example, the GSS, the General Social Survey, has been, over the last few years, linking data to tax, linking survey respondents to tax data so that we don't have to ask those questions. That's the ultimate plan. So we don't have to ask all the on the income questions. We just find it from tax data when we can link you. And that's a very useful thing that eats up several minutes, or saves several minutes, for example, of the questionnaire. Here's a slide from an article in 2014 on victimization of Aboriginal people in Canada. It's the victimization cycle is a very valuable cycle for analyzing victimization of Aboriginal people. It has enough data to do that. The essence of this slide is that Aboriginal people suffer victimization from violent crime at a much higher rate than non-Aboriginal people. and in particular women, Aboriginal women suffer victimization more than non-Aboriginal women at a much higher rate. This seems like a non sequitur, this slide. I'm now going to go to just something we cut and pasted in from an age pyramid like Gustav's age pyramid. I like, by the way, Gustav, the young girls bump. What we've discovered in recent work is that young Inuit boys, or male Inuit babies, die a lot. It's a really sort of sad kind of situation. They have a much higher mortality rate than every other group, basically. That being said, the reason this looks like a non sequitur, but what it is when we build these slides, when we build these presentations, there's a lot of sad stories. And we're trying to move away from, in Aboriginal analysis section certainly, but more generally at StatsCan, there are a lot of sad stories. We're trying to move away from a deficit-based approach, which has been the classic approach. Things are bad. Things are bad for Aboriginal people when we compare to non-Aboriginal people. Victimization is higher. We're trying to move away from that to a more resilience-based approach. And we are looking at factors that improve the lives of Aboriginal people. There are some good stories. Aboriginal people are middle classifying, to invent a term. The middle class is growing. There are demographic stories like urbanization of Aboriginal people. Urbanization, by the way, of Aboriginal people is not because the people are moving from reserves. That's not necessarily. The movement is both ways. There's growth in the Aboriginal population. This is a slide. Oh, good. He did erase that slide. Thank you. There was a slide I forgot to have translated, so I asked him to erase it. The Aboriginal population is young and growing. The urban population is growing, but it's also aging, which is sort of a little weird demographically. It turns out that the Aboriginal population is growing for a number of reasons. First of all, the fertility rate is slightly higher, but also it's a complex process of identifying. In our surveys, in our census and in our surveys, it's people who self-identify as Aboriginal. There's a term I don't like called ethnic mobility because the reason I'll tell you why I don't like it is because it sounds like they're moving ethnicity. People are moving ethnicity. In fact, they always were a particular ethnicity. They're just discovering themselves as, in particular, Aboriginal or Métis or Inuit. So it's a complex process. Each individual makes up their own decision about their identity, and so there are changes, there are demographic shifts going on that are quite interesting. Here's an interesting administrative data thing. Many administrative data sets do not have an Aboriginal identifier on them. For example, there's something called the Discharge Abstract Database, which is a database that contains hospitalizations in Canada. In our case, in all provinces except Quebec. Quebec has its own system, and so we don't have that database from. We get it from the Canadian CIHI, Canadian Institute of Health Information, and it does not have that. It's a really cool data set. It has all information about hospitalizations in Canada, outside of Quebec, the reason you were hospitalized, the length of stay, various other very cool things, from which you could understand rates of hospitalization for injuries, say. I started working on a paper on that, for example. The problem is that administrative data set, while cool, does not contain an Aboriginal identifier, nor an immigrant identifier, nor other types of identified. No, not enough detail about each person is available. So what do? We do a very cool thing. We link it to the census. And so we linked it to the 2006 census, and you could follow the people on the 2006 census and their hospitalizations throughout. We've done a similar thing with deaths. You can follow cause of death, for example. For the people who were alive in 2006, why did they die? And the census, the important thing about the census from our perspective is it has Aboriginal identifier. Person identifies as Aboriginal, yes or no, ancestry, etc. And so now you can ask the question, is there differences in the rates of hospitalization for various things by Aboriginal or non-Aboriginal group? The answer is yes. And you can ask questions, social determinants, in as much as you have them on the census. So I can read this. It says it's about housing conditions and respiratory hospitalizations among First Nations people in Canada. Rural unreserved First Nations people were more likely than non-Aboriginal people to be hospitalized for a respiratory tract infection, 1.5% versus 0.5%, or for asthma, 0.2% versus 0.1%. For respiratory tract infection hospitalizations, adjustment for housing conditions, household income, and residential location reduced differences, but the odds remained nearly 3 times higher for unreserved First Nations people and 2 times higher for off-reserved First Nations people. So you can actually run models, which is a very nice thing, with various social determinants. Some things that are upcoming. As you know, the 2016 census happened in May, well, I'm not sure, May 20th, something like that, 2016. It is being published in waves. Parts of it are being published. The population and dwelling counts have already been published. But various characteristics, the next slide shows you when things are planned to publish. As a consequence, since it's a post-census survey, there will be a 2017 Aboriginal Peoples survey. That survey has some interesting supplements for Nunavut, 2 interesting supplements for Nunavut. So here's the publication schedule, the planned release schedule, if you will, of the data. Because it's a big project, it takes a while to process the data, and so we release information slowly in waves. The relevant thing for you is that in October 25th, 2017, we plan to release information on Aboriginal identity and Aboriginal ancestry. After the final release in November 2017, all of the information will be available. And it's available in the RDCs as well. There is a copy of the census microdata files available in the RDCs. The 2017 survey target is about 48,000 people. Again, estimates by region and by group. It again will exclude reserves and selected First Nations community in the Yukon and the North. There is a theme. It's economic participation, focus on employment, skills and training with a health supplement. Collection has just started. It's just started in January 2017. We plan to release the data in the fall of 2018. Some content items here: barriers and levers to economic participation, labor mobility, entrepreneurship, post-secondary education, targeted skills training, economic well-being, core, and again with the core content and the supplement with health. It's important to note that we are now doing, in the past we did the omnibus approach, now we're doing thematic approaches, but you can still compare data over time. That's the very powerful aspect of these. These are cross-sectional surveys, but they're consistent over time. Questions are consistent as best they can be over time, and methodology is consistent as best they can be over time. So we do have, the bootstrap weights are consistent in the terms of the methods that they were created. They're useful. Estimation can be done in the same way over time. It's not the same people, obviously, so you can't do a specific cohort analysis, but you can do some longitudinal work. There are two supplements. There's the Nunavut supplement. There are two aspects to the Nunavut supplement. There's something called NILFA, the Nunavut Inuit Labor Force Analysis, and there's the Nunavut Government Employee Survey supplements to that. Let me end by talking about ways in which you can access our data. Now, you are RDC people, so you already have access to some of our microdata, but there are many ways of accessing our data. There is the website, first of all. If you're just looking for some quick answers, the website is a bit of a challenge, I'll admit, to navigate. And if you've tried to navigate it, even I have a lot of challenge to navigate. I looked at subject matter and things like that. It is a bit of a challenge, admittedly, but there's lots of help. So we're happy to help you navigate it. We have experts who are able to do that. One can order custom tabulations. They cost money. There are general tabulations. There's tons and tons of stuff on something called CanSim, our socioeconomic database. I don't know what it's called exactly, but a time series. There's tons and tons of tables there already. You can order custom tabulations. They cost a bit. It costs, $600-700 a day. I don't know. Don't. It's being recorded, so I don't want to say that as an official number, but there are ways of ordering custom tabulations. Microdata files, as you know, are available in the RDC network. There are PUMFs as well, public use microdata files, that are available through various share access methods. There is real-time remote access. That's a very cool thing, where you can submit a program. Typically in SAS, we work, but you can submit a program and run it against the data, and out pops information, which is already vetted for confidentiality. Aggregate tables, for example, already vetted for confidentiality, and research data centers, as I said. In particular, we have the APS public use microdata files. We have the APS data files available in the RDCs, 1991 to 2012, and there is the Aboriginal Children's Survey RDC file from 2006. Two more slides with just pictures on them. I put these into the presentation. I'm not going to actually talk about it, but there's various ways of this. Shows a picture of various ways of accessing data using the website. And here are some detailed instructions on if you're looking for things. I typically look by subject, but there's various other things, main resource and that sort of thing. This is the thank you slide and questions and commentary slide. Thank you for listening to me. I did use up my 43 minutes, whatever it was. One thing I want to stress, though, and I put a big boldface note to myself, collaboration with us, ! By that I mean we are always looking to collaborate with people. We do analysis, Aboriginal analysis, or analysis on Aboriginal populations. Someone in the back there is just about to publish a paper, who used to work for me, roughly July-ish, not quite sure exactly when, but she's written a very cool paper on teen mothers. I don't want to say teen mothers, on school, and that's the kind of stuff we do. We do a lot of that. We are always looking for collaboration. We would be happy to collaborate with academics and with students and RDC researchers. We would be happy to collaborate with them. If you have the deemed employee status already, that's a very good thing. That helps a lot. If you don't, then we have to, we can make various arrangements. We have collaborated with our National Aboriginal Organization partners on occasion to publish papers, and we're always looking for ideas. If you have ideas that you can't do, we would be happy to look into them. We have other ideas that we can't do. We can't do for just capacity reasons, and we would be happy to share with them. We're always looking for collaboration! Thank you.